This is our presentation on NHS structure and function in Scotland. This presentation will cover the basic structure of the NHS in Scotland, the major roles of the key organisations involved, main differences in relation to pharmacy services in England, and how the patient experiences may differ in Scotland. NHS Scotland refers to the Scottish Medicines Consortium for Clinical Advice, which is the Scottish equivalent of NICE in England. Scottish Parliament produces legislation for NHS Scotland, and it's accountable for the Cabinet Secretaries and Ministers within the Scottish Government. The Scottish Government decides on the NHS budget it receives, sets national objectives and priorities for NHS. Cabinet Secretary for Health and Wellbeing has ministerial responsibility for NHS in Scotland, and ministers are supported by the Scottish Government Health and Social Care Directorates. NHS boards. These plan, commission and deliver NHS services within Scotland. For example, services from GPs, dentists, pharmacists and opticians. Now they're made up of 3 different board types: regional boards, specialist national NHS boards and healthcare quality strategy for Scotland.
Regional boards. Boards are accountable to Scottish ministers. Each is responsible for its own population. They are made up of both non-executive, lay and stakeholder members and executive members. Non-executives are appointed by ministers. Executives hold a place by virtue of their employed position within the board, example, chief executive. Regional boards have 4 key functions: strategy, development, resource allocation, strategy, implementation and performance management. The areas are as follows.
These are the special national NHS boards: NHS Education for Scotland, NHS Health Scotland, NHS National Waiting Time Centre, NHS 24, Scottish Ambulance Service, the State Hospital Board for Scotland, NHS National Services Scotland. Healthcare Quality Strategy for Scotland actually has 2 aims: to provide the highest quality healthcare to the Scottish population, to ensure the NHS, local authorities and third sector work with patients, carers and public towards 3 ambitions, which are safe, efficient and patient-focused care. Quality Alliance Board and Quality Ambition Delivery Groups set up to promote and implement the healthcare quality strategies 3 ambitions.
Community health partnerships. Key mechanism for planning and delivering primary care and community-based services. There's a total of 36, funded by regional boards. Set up in the community, covers all aspects of health and social care, act as NHS board committees, involves local authorities, patients and the public via public partnership forums. National Services Scotland. This comprises of the following organisations: Counter Fraud Services, Health Facilities Services, Health Protection Scotland, National Service Division, Practitioner Service Division, Information Services Division, Scottish Health Service Centre, Scottish National Blood Transfusion Service, Scottish Healthcare Supplies, Central Legal Office and National Information Systems Group. How does the patient experience differ in Scotland compared to England? The patient experience in Scotland is controlled by NHS Scotland. It is easier to see a GP with an ailment whilst living in Scotland in comparison to living in England. Car parking in hospitals is free in Scotland whilst charges apply in England. Pharmacies. Patients in Scotland have free prescription, whilst in England there's a charge of £7.85. Scotland runs the minor ailment scheme across the country.
Main differences in relation to pharmacy services in England compared to Scotland. Unlike in Scotland, not all pharmacies can offer the minor ailment scheme in England. MURs are not used in Scotland. New medicine service is only available in pharmacies in England and not in Scotland. All advanced services in England, such as MURs, NMSs, SACs and AURs, are not available in Scotland.